meeting.
Good morning, everyone.
Good morning.
Good morning, Mike Chambers here.
Good morning.
Hey, Ricky, it's Sharon. Hey, I'm not hearing anybody on my end. My computer name?
This is Lenora. Who's not hearing?
That's Sharon, I think she's having trouble.
Oh,
Whenever you're ready. That's okay. Yeah, I mean, I started, but we still have a couple of minutes.
you're not hearing?
I'm not hearing, no. Are you, Lenora?
Yeah.
Oh, you can hear me? Okay. Okay, you know, Ricky, I'm sorry. Well, everybody can hear me. I can't hear anybody else. You mute this real quick.
When you logged in, did you check your
923.
audio?
I had trouble with my computer when I first came in this morning. So I don't know if that's related. Okay. I can't hear anybody.
You have that thing, like a jack, like for your phone, because you can use the audio over to it.
Yes, I heard that.
It's coming up, yeah.
But it made noise.
Mm-hmm.
Let's see.
Welcome to Zoom. Enter your meeting ID followed by pound. Enter your participant ID followed.
Oh, man, thanks for calling in.
Hello, Dan.
Hello. All I have to do is unmute.
Hi, this is Lenora. We're just trying to resolve a technical difficulty. Worst case, she'll come in my office to start the meeting. She's on the
Okay.
phone now with IT.
Thanks, Lenora. We'll wait.
Okay, Mike,
Yes.
I'm good on my end now.
Okay, great.
Let's see, do we have Nicole? Okay. Do we have Trevor?
Yes, Sharon, I'm here. Good morning.
Okay, thank you, Trevor. Good morning. Okay, whenever you're ready.
Okay, thank you. Good morning, everybody. Monday, May 3rd, 2021, Board of Control. Will the clerk please call the roll?
Good morning. Calling the roll for the Monday, May 3rd meeting. It is 11:03. Dale Miller,
Here.
Nan Baker,
Here.
Trevor McAleer serving as an alternate for Purnell Jones,
Here.
Mike Chambers serving as an alternate for Armin Budish,
Here?
Lee Tucker serving as an alternate for the fiscal officer,
Here.
Nicole English serving as an alternate for Mike Dever,
Here.
Lenora Lockett.
Here.
We have a quorum.
Okay, thank you. At this time, I'm going to make a motion to approve the minutes of April 26th. Do I have a second?
Second.
I think I heard Councilman Miller, seconded by Councilman Miller. All those in favor say aye.
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 Opposed? Okay, the minutes are approved. Moving on to public comment. If there's anyone from the public that wishes to speak, do so now, please. Okay, there is no public comment. Moving on to contracts and awards, please.
First item, BC 2021-199, Department of Public Works, recommending an award on requisition 4804 and enter into a contract with CRS Metalworks Incorporated in the amount not to exceed $395,500 for the heating, ventilation, and air conditioning replacement project at the Cuyahoga County Animal Shelter.
Good morning, Mr. Chair. This is Matt Reimer representing the Department of Public Works. This contract award request is the result of a formal bid where we had 7 bidders respond to this. This project will remove and replace the air handling unit and the condensing unit that services the HVAC services for the main kennel area of the animal shelter out in Valley View. This is a replacement in order to keep adequate temperatures for the dogs in the kennel area, in the main kennel area. As mentioned, we had 7 bidders for this. This is the lowest and best bidder. The engineer's estimate going into this formal bid was $440,000. So we are underneath the engineer's estimate with these bid results. Happy to answer any questions.
Thank you, Matt. Are there any questions from the board on this item? Hearing none, I will make a motion to approve. Do I have a second, please?
Second, Miller.
Seconded by Councilman Miller. All those in favor say aye.
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 Opposed? Item approved. Next item.
Next item, BC 2021-200, Fiscal Office, recommending an award on requisition 5474 and enter into a contract with Manatron Incorporated in the amount not to exceed $125,462.93 for a sole source purchase of Marshall and Swift rate tables data licenses for the period January 1st, 2021 through December 31st, 2021.
Good morning. This is Michael Zapola from the Fiscal Office. This is a long-standing agreement we've had with these guys. We've used them for 31 years, according to Dan Harbaugh and the appraisal group. This provides standard valuation cost analysis data to basically accurately assess the valuation of residential and commercial property throughout the county. We do anticipate some relationship with this going forward, even after we go to the new Harris product.
Okay, thank you, Mike. Are there any questions from the board on this item?
Just one question, Nan Baker.
Yes.
On the response, which was confusing to me, it said the project status and planning. The project has reoccurred annually in past years. Evaluation of the continued need for this service is to be determined with the implementation of the ERP system. And I guess that's why I was a little confused as to whether or not this was going to be a part of the ERP system. By the answers that I've been given, it looks like it will not be. So why was that statement made in the backup of this item?
I'm sorry, Ms. Baker. I'm trying to find where that statement was made.
The third to the last paragraph on the backup.
On the backup?
Under project status and planning.
Okay, the project has recurred annually in the past years. Evaluation, okay, the need of service determined by, yeah, we know we need this product going forward, but under the legacy system, it's a certain way. Under the Harris system that we're converting to, it may take on a different form, but it will still be needed going forward.
It will be.
Yes.
Okay.
That was, yeah, Lisa Rocco confirmed that in her response as well. ERP will not and cannot provide the rate tables.
Okay. So what does the ERP have to determine with the implementation? What is that? How does that play?
This, I believe this is the ERP on the Harris side. This isn't the infor ERP.
Okay.
That's probably where the confusion is, and I apologize. It's the replacement of the Manatron legacy tax system.
Okay, I see. All right. Well, thanks for clarifying that. I appreciate it.
Sorry about that.
Okay.
Are there any additional questions on this item? Hearing none, then I'll make a motion to approve. Do I have a second?
I'll second. Nan Baker.
Seconded by Councilwoman Baker. All those in favor say aye.
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 Opposed? Item approved. Next item, please.
Next item, BC 2021-201, Department of Human Resources, submitting amendment to a contract with Health Management Systems Incorporated for dependent eligibility review services for the period March 26, 2018 through April 15th, 2021, to extend the time period to December 31st, 2021, and for additional funds in the amount not to exceed $9,990.
With the Department of Human Resources. This is an amendment to our current contract for dependent eligibility audit services to extend through the end of the year. This will provide us the time needed to finish our informal RFP process, which is currently scheduled to close on May 12th of this year. The contract and the amendment have our standard 30-day out clause, so we can end this contract once the new contract is in place. But again, extending through the end of the year gives us time to handle the county's award process and work with the vendor to get the new contract in place without having to worry about a upcoming deadline. In 2020, there were 282 dependent verifications done. They do these verifications anytime a county employee adds a dependent. They contact the employee for information and documentation regarding the dependent to make sure that they are eligible under our health plan. The fee is $18.54 per review. We've also done complete audits of all of our county dependents in the past when we believe that they're needed. There is not one yet planned for going forward, as we're still working on establishing our new contracts for this service and the rest of our benefit services, including our health care plans. This contract amendment is late due to a staffing issue that we had in HR that was left open due to the hiring freeze, which has now been resolved. There was also some delays in getting signed documents back from the vendor.
Hey, Stephen, thank you. Are there any questions from the board on this item? Hearing none, I'm going to make a motion to approve. Do I have a second, please?
Second, Miller.
Seconded by Councilman Miller. All those in favor say aye.
Aye.
Opposed? Item approved. Next item.
Next item, BC 2021-202, Department of Information Technology, submitting an amendment to a contract with Unify Solutions Incorporated for SAP Human Capital Management Support Services for the period July 1st, 2017 through December 31st, 2020, to extend the time period to February 28th, 2022, and for additional funds in the amount not to exceed $455,000.
Good morning, Janelle Green on behalf of the Department of IT. This contract is an amendment to extend the contract with Unify Solutions, which is a staffing augmentation service that provided support to our web services team in the area of SAP and the human resources area. This contract has long been in place, and they know the ins and outs of our system, and will go away. The contract will go away once ERP's payroll and WFM modules are live, and we're asking for an extension to carry us through that time until those systems are live.
Thank you, Janelle. Are there any questions from the board on this item, please? Hearing none, then I will make a motion to approve.
I'm sorry, Chair. I just want to make sure.
No problem.
There are a couple of ERPs on here, and I just want to make sure I'm going to ask the right one for the right question.
Absolutely.
So I see on the, is this illustrated on the page 19 of the ERP group meeting that we had, or not? Because I can't really see it. I see the next one on 203 listed for 252, but the amount of 455,000 on the backup, or I should say the explanation says that it's on the April 23rd slide, but I don't see it on the April 23rd slide. And I'm just wondering if that maybe was given to us in error.
Okay, I'm looking at this. This is the, it'll be $142,000 from Unify. So this is a mixture of things. So there'll be some ERP support, but this is largely for support of the actual legacy systems and also support in HR. So the bulk of it will be for the legacy system and HR, but there will be some portion of it that will assist with ERP.
All right. I'm sure I'm on the right one here.
I think I'm getting the.
This is Jack Ryan.
It is on page 19, but it's only the portion that will be attributed to the ERP.
Right.
To the ERP capital budget.
Under the Unify.
Yes.
Okay.
Yes, ma'am.
Okay, so under the Unify, we have 142,000.
Correct.
And then if I'm reading this correctly, let's see. The ask is for 455,000.
That's correct.
So if we have 192,000 that's being split with implementation and another 192,000 that is capital, is the difference the 142? Is that how we get there? Because if you add 192 and 192, it doesn't equal 455.
No. It's 142 for it's $142,000 that is for ERP. The remainder is general fund split between HR and the general fund for Department of IT.
Okay, in the explanation that we received, it says that it was split 192,000 and 192,000, which equals 384,000.
Okay, I apologize for that. That is erroneous. But that's how we've worked on the split. So it is the 142 that will be attributed to ERP, and the remainder will be general fund split between Department of IT and HR.
I didn't think those numbers worked. Okay. So
I apologize for that.
that's okay.
But that's how we worked on the split.
Okay. Is it too much to ask to say, can you give me then, as long as we're talking about where this money's going? I know that Unify is 142. Where's the rest of the money going then?
$120,000 of it is from HR's portion.
HR, okay.
And the remainder is the general fund from IT.
Okay. And is the remainder of the general fund for IT, is that considered implementation?
No, that would be legacy support, because outside of ERP, we still have to maintain the legacy systems and make sure that, everyone gets paid. So it's outside of the ERP process. That is our general, how we operate every payroll every 2 weeks.
So what is attributed to the implementation?
Implementation is the $142,000 for ERP. That's solely the capital cost for that.
That's the Unify.
Correct.
Okay, and that would be added to the overall project cost.
It should already be factored into the project cost.
It is listed on that page 19. This is Jack Ryan.
Hi, Jack.
It is listed on page 19 on the lower left-hand corner as part of that list.
I see it's under Unify.
Yes, ma'am.
142. But that's all that's listed on there. The rest of it is not.
Right. It's not, because that report was focused on ERP implementation.
So the question that we asked, what is the total of the ERP due to the increase of the, I guess it's now 142? Is your answer of 35,970,903 correct still?
Yes, those numbers, that number was included in there.
Okay. It was
From my March 31st report, those numbers were included.
okay with the 142.
Mm-hmm.
42,000 Unify is in the 35,970,903.
Yes.
Just trying to follow the paper trail, that's all.
Right. And sometimes, because when Jack presents those reports, he's looking at specifically the capital project budget versus the general fund items that IT has long supported.
Okay. Okay, I think that's what I have. Thank you, Chair.
Absolutely. Any additional questions from the board?
Mr. Chair, this is Trevor. I just
Yes,
had
sir.
kind of follow-up questions from Councilwoman Bakers. So Jack or Janelle, it's my understanding, right, that the request to council will be an additional appropriation of a little over $600,000, which includes the 142 for Unify.
Right.
Correct.
Is that right?
Correct.
Yes.
Yes.
But so where is the remaining $300,000 coming from on this contract request for Unify?
Those are general fund dollars. So the $193,000 is from DeWitt's general fund, and the other $120,000 is from HR.
And though those two appropriations are already included in this year's budget for both departments?
Correct.
But we weren't expecting this contract, correct, in 2021, right? We're only going forward with this contract because of the delay in the ERP.
Correct. So, but we already had appropriation. We are not seeking additional appropriation to cover the cost of this contract.
Is there something that's not being funded, though, that's going to cover this Unify contract? Because if we weren't anticipating it, you wouldn't have had appropriation, right?
So it was included in our biennial when we submitted it in 2019 in the event that, the project was not completed. So we had the appropriation for it already factored in.
But in terms of projected expenses, right? I mean, this is an additional expense that we weren't anticipating.
Right, but typically this contract annually for DeWitt was $476,000, typically. But in this instance, because we're transitioning away from it, this is actually at a lower cost than we had anticipated in that particular general fund accounting unit.
So do we include the additional 300,000 in the, is the 300,000 in the $35.4 million number at all?
No, because the $35 million number is the ERP capital budget. General fund is not including in that. So these are things that would have been under our general operating, general fund dollars. So the $35 million number is specifically geared towards the ERP capital budget. So the other $300,000 would not be factored into that budget at all, because this is The $300,000 is for operational support of legacy systems and not for implementation. So we separated specifically implementation, just giving, per the guidance, the GASB guidance provided, we only are attributing implementation costs of the ERP into the capital budget. So anything for general operations would not be included in those numbers.
Are you separately tracking, Janelle, the additional costs that we're seeing because of the delayed ERP implementation though?
Yeah, so we have separate budgeting for that, for the operational cost of the ERP because of having to sustain the legacy systems longer than what we initially anticipated.
And is that once this is approved, that 300,000 will go in that bucket?
Correct.
And what's that total, including the 300,000? Do you have that?
I don't have that readily available, but I can send that out after the call.
Okay. And will it include this 300, whatever number you email us, or will we have to add the additional 300?
They will include the numbers.
Okay. Thank you.
Sure.
Chair, if I may.
Yes, please.
So just to be clear, after that conversation, on the slide 19 of Unify of 142,000, that is directly ERP implementation, and that is included in your total of 35,970,903.
Yes, that's correct. This is Jack Ryan.
Okay. Okay.
Mr. Chair, can I ask one follow-up?
Absolutely, please.
Jack or Janelle, do you anticipate when the 600,735 will be coming to council?
I know we've been working with OBM on that, and I think they're trying to get it in front of council at the next council meeting, I believe.
Okay. So maybe a week from tomorrow?
I believe so. I don't have the date.
I think we submitted that and they said that it should go for the next meeting.
Yeah.
Thank you.
You bet.
Any final questions from the board?
Just one, I guess. I'm sorry, just want to get it clear. So when you ask for the 600,735 to council in the next week or so, will that be less what we're approving today of the 143,000? Will that number change because we're approving 143,000 today, or 142?
No, it should be inclusive of that cost.
Okay. It'll just be noted that 142,000 has already been approved in that 600.
Yes.
Okay. Hard to keep track of.
All right, then, hearing no further questions, I will make a motion to approve this item. Do I have a second?
Second.
Seconded by Ms. Nicole English. All those in favor say aye.
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 Opposed? The item is approved. Next item, please.
Next item, BC 2021-203, Department of Information Technology, submitting an amendment to a contract with Infor Public Sector Incorporated for information technology services and solutions for the Enterprise Resource Planning System for the period October 27th, 2016 through February 11th, 2022, to modify the scope of services effective May 3rd, 2021, and for additional funds in the amount not to exceed $252,000. On amendment number 65, to provide resource support by engaging 2 technical senior consultants to assist with payroll, landmark, and workforce management modules.
Janelle Green and Jack Ryan here on behalf of the Department of IT. This item is, again, amendment number, change order 65 to the Infor Professional Services contract. This will add on 2 technical resources for those modules that Sharon read off. Again, payroll, landmark, and workforce management. One of the resources will be for the implementation, and that is at the larger amount, the $192,000 amount. The other $60,000 would be for time and material support once the modules go live. So the reason for the funding source split, that's the 76% is attributed to the ERP and the 24% is general fund.
Okay, thanks again, Janelle. Any questions from the board on this item?
So if I may, Chair,
Please.
just for further clarification, this seems more black and white. The CO65 is listed on page 19, and it is split that way. And that's pretty clear cut. So there's no deviations from that. That's what you're asking for.
Yes, ma'am. This is Jack Ryan.
And that 192, that is ERP implementation, that will also be part of the 600,000 that you'll be asking for, but will be noted that this was approved in Board of Control.
Yes, ma'am.
All right, thank you.
Any follow-up questions from the board?
Chair, I just have one follow-up on that one. On Janelle, on the 60,000 column, that's IT ERP operations, would that fall in under the separate tracking that we were just talking about that you're going to email us? Would that 60,000 fall in that category?
Yes.
Okay.
Okay, any final questions on this item from the board? Hearing none, then I will make a motion to approve. Do I have a second, please?
Second, Miller.
Seconded by Councilman Miller. All those in favor say aye.
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 Opposed? Item approved. Next item.
Next item, BC 2021-204, Department of Information Technology, submitting an RFP exemption, which will result in an award recommendation to Surety Systems Incorporated in the amount not to exceed $155,000 for staff augmentation services for the stabilization of the Enterprise Resource Planning System for the period May 3rd, 2021 through November 2nd, 2021, and recommending the award in connection with said RFP exemption.
Janelle Green and Jack Ryan on behalf of the Department of IT. This is staff augmentation services, again, for the support aspect of running the ERP. This contract is in place due to the termination of two of the other contracts that we had for support in this area. And I don't know if Jack wants to add anything else to that.
Yeah. So we've, no, I think that's it. We're replacing some consultants that rotated off the project and or were terminated. And this is, we've interviewed a number of people, as I said, and I think the notes that I sent over, and feel like we've selected the best consultants possible to fill the role that we need for the ERP stabilization technical support involved.
Okay, thank you, Jack. Janelle, any questions from the board on this item?
Yes, this is Dale, and I have one question for Jack, and it's about surety systems. If you could
Yes,
tell
sir.
me a little bit more about them, whether this is an individual or whether this is a company, and just tell a little bit more about who they are and what they do.
Well, Surety Systems is a company. It's not just an individual. They supply consulting resources pretty broadly across a variety of areas, and they have some specialization that drew us to them for infor support. And we've interviewed a number of resources from them. This happens to be the only one we've selected at this time. But the way that their contract is written, if we decide to take additional resources, we come back to the Board of Control for those, but the contract is organized so that we could do that. So they're a broad-based consulting firm for IT services.
So if I might follow up, when we use a broad-based consulting services, there's usually a markup involved in that, in that there's a cost to hire the individuals that we're hiring, plus the overhead for the company that's running the show. And my question is whether you have canvassed extensively to find out whether there are individuals who could provide the needed services at a lower cost.
Yes, we've in addition to talking to consulting firms like Surety, we've also had running advertisements of our own with firms like ZipRecruiter, and in this particular case, we've not been able to attract somebody with these skills through our own channels. And so, yes, there is a markup, but the markup, well, I don't know what their markup is. I'll put it that way. I'm not privy to their internal statements, but compared to other consulting resources, the rates that we've gotten are pretty reasonable.
Okay, thank you.
Yes, sir.
Any final questions from the board?
Just a question, Chair, Nan Baker.
Yep.
So the amount that is being asked is, what's here, 155,000, I believe. And those dollars have already been approved for different people, but those fell through. So we're now going to Surety to fill the gap. Am I right about that?
Yes, ma'am.
So this isn't additional dollars. These are dollars that we've already approved. You're just moving it over.
Correct.
Correct. Why is it, I guess, listed on page?
Never fails.
Oh,
See
wow.
who it is now.
Oh, boy.
Yeah, who is this?
There we go. Thank you.
Okay.
So I guess I just want to make sure I understand. It's listed on page 19 as an additional dollars of 155,000 under Surety Solutions. If we've already approved that, I guess I'm asking, why is that added back in?
So we adjusted we never did actually submit the other appropriation where the two original contracts were on.
Oh,
So these were included in the final appropriation that actually is being requested. So there was never an additional appropriation requested for I think the original amount might have been
360,000. Oh, you know,
No,
about the
for the-
original
the
appropriation.
appropriation.
Okay, I'm sorry.
That's shown on page 19. The original appropriation was 581,000. We only increased, I say only, by 19,000 to the 600,000 or so. But those contracts were in the original list. We're just swapping out different contractors in this case.
okay. So these numbers, you've deducted the 155 and now you're adding it back in?
We're adding it back in differently. It's not exactly the same amounts, but it's in the total. Yes, ma'am.
Hmm.
It's all included.
Okay. Thank you, Chair.
Absolutely. Any other questions from the board?
Mr. Chair, just one follow-up question.
Yes, sir.
Jack or Janelle, on page 19 from the presentation, there's the column of IT, ERP operations, and then department operations. Will IT need an additional appropriation to cover the 544 and or the 120, or does IT currently have enough appropriation to cover those two columns?
The operations column.
Okay. I'm just looking at 19 right now.
Yeah.
Currently, we do not need the additional appropriation.
Okay.
So you have the 664 total there within your existing budget to cover those, to cover the forecasted expenses?
No, department operations, the 120 is not ours. It came from HR. So the 544 is ours.
Okay.
So when it's listed out department operations, because it can be from any number of departments, we just listed generically as department operations, and that goes with something other than IT's department.
Janelle, do you know offhand, do they have that 120 or will an additional appropriation be needed for that 120?
That 120 was for the previous, 2 items ago for the SAP. And so in ERP, they had those funds. We would have been able to push this forward because it went through the proper channels in ERP. So they did have those funds available.
Yeah.
Okay.
And since we didn't expend them, they still have them available.
And you're good on the 544.
Yes.
Yes.
For right now, we are good for what expenses we have currently. Yes, we are good on the 544.
Thank you.
Thank you.
Now, it's Chambers. I'm assuming that we may have to do a realignment if that's the case.
Yes.
Okay. So Trevor, to answer your question, they may be good. They may have other areas that will have to eventually come before council and do realignment. So,
Appropriation transfer or something.
yeah, and
Correct.
I prefer that
Correct.
rather than increasing. We do that for a lot of departments right now. We're not just going to increase when we see that there's opportunity elsewhere. So.
Right. I agree, Mike. And I think that's helpful for, Councilwoman Baker and Councilman Miller, right? Just knowing what might require an additional appropriation. But if we're able to find it within the existing budget, it's helpful.
Right. So that's what we've been
that's
working on, is just moving the money in between accounting units. I'm trying to get away from using index codes, but accounting units as we need them to cover contracts. So that's where we are. If we do need that, we will use that option first before asking for additional appropriation.
Okay. Absolutely. Okay, thank you. Hearing no further question, I will make a motion to approve this item. Do I have a second?
Second, Miller.
Seconded by Councilman Miller. All those in favor say aye.
Aye.
Opposed? Item approved. Next item.
Next item, BC 2021-205, Department of Sustainability, recommending an award on requisition 5420 and enter into a contract with Bongiorno Consulting LLC in the amount not to exceed $40,000 for consulting services for network infrastructure planning in connection with the expansion of the Cleveland Cuyahoga Bike Share Program for the period March 1st, 2021 through February 28th, 2022.
Hi, this is Mike Foley from Sustainability. So this is a contract with Bongiorno Consulting to help us build out the rebalancing hubs that are necessary, the scooter, bike share, e-bike network that we're developing with dollars from NOACA. So a couple years ago, as you may recall, we had the UH bike system that we were able to get resources from NOACA on. We applied for more money back in 2018 for capital costs, the UH bike system. But in the meantime, kind of the nature of bike share and kind of the systems changed dramatically. It went from pedal bikes to scooters and scooter companies coming in, basically paying for their own capital. So NOACA has agreed to allow us to use this money to build out this network for Cleveland and 6 or 7 first ring suburbs, so that people, when they want to ride a scooter, they know where scooters are going to be. They know where to drop them off at. And these balancing hubs will have just kind of different types to them. So some will need racking systems, some will need like just sidewalk tape. There will be signage associated with it. So the contract with Bongiorno is to help. We've got rough estimates of where all the sites will be, but Bongiorno is going to be putting this all together and then kind of figuring out what kind of equipment we're going to need for use with the NOACA dollars later on in the fall, hopefully.
Thank you, Mr. Foley. Are there any questions from the board on this item?
One quick question.
Yes.
So the 300,000 through NOACA and ODOT, in addition to our 40,000, does that complete the project? Is that enough to do what you explained here needs to be done in order to provide this?
Yeah, I think so. I think it'll be more than enough. I don't think we'll use the 300,000, to be honest with you, at the end of the day.
Is our 40,000 the last money in, or do we spend it first and NOACA and ODOT save on whatever's not used?
So our money is to design it, to figure out what equipment is needed for the capital cost. And that money comes from the Sustainability Fund, which has, we license, the county licenses scooter and bike share companies. So that money's coming from those license fees for the most part.
Okay. So ours is the design and theirs is the implementation? Is that what we're saying?
That's accurate. Yeah.
Okay. All right, thanks for the clarification.
Any other questions for Mr. Foley from the board? Hearing none, then I will make a motion to approve. Do I have a second?
Second, Miller.
Seconded by Councilman Miller. All those in favor say aye.
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 Opposed? Item approved. Next item.
Next item, BC 2021-206, Court of Common Pleas, Juvenile Court Division, recommending an award on requisition 2652 and enter into a master contract with various providers in the total amount not to exceed $80,000 for drug screening and testing services for the period February 1st, 2021 through January 31st, 2023 with Redwood Toxicology Laboratory Incorporated in the amount not to exceed $61,000 and with Safety Controls Technology Incorporated in the amount not to exceed $19,000.
Good morning, this is Sarah Baker from Juvenile Court. The court did complete an RFP for this contract term for drug screening and testing services. These were the only two vendors that applied. Historically, we've only contracted with Redwood Toxicology Laboratory, but this year we've added in Safety Controls Technology, which is a local company that we're able to utilize occasionally. We have some, between the pandemic and the wildfires in California last year, we needed to add more of a local service since that's where California is where Redwood is located. So we're asking to move forward with this master contract.
Okay, thank you, Sarah. Are there questions from the board on this item? Okay, hearing none, I will make a motion to approve. Do I have a second?
Second.
Second up by Councilman Miller. All those in favor say aye.
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 Opposed? Item approved. Next item.
Next item, BC 2021-207, Court of Common Pleas, Juvenile Court Division, submitting an amendment to a master contract with various providers for trauma-informed treatment services for court-referred youth for the period October 1st, 2018 through September 30th, 2020, to extend the time period to June 30th, 2021, and for additional funds in the total amount not to exceed $30,000 with Applewood Centers Incorporated in the amount not to exceed $10,000, with Ohio Mentor Incorporated in the amount not to exceed $10,000, to add Pals for Healing in the amount not to exceed $10,000 effective October 1st, 2020, and to remove Catholic Charities Corporation effective October 1st, 2020.
Good morning, Sarah Baker again with Juvenile Court. This is an amendment for our trauma-informed treatment services. This program specifically serves youth that are on our safe harbor docket. So what we're trying to do with this amendment here is continue with Applewood and Ohio Mentor, but we would like to add in a new provider, which is Pals for Healing. And then we would also like to remove the provider Catholic Charities from this contract. Historically, this was funded by our VOCA grant, which expired September 30th of 2020. So we needed to write it into a different funding source as we realized that we were not going to have enough VOCA grants to support this project. So we were able to incorporate it into our reclaim grant going forward.
Okay, thank you again, Sarah. Are there any questions from the board on this item?
Nan Baker, if I may.
Please.
So Sarah, this is now under a different grant. It's not under the grant that we originally had the contract from 2018 to 2020. Is that right?
Correct. Mm-hmm.
So I guess it's just curious that we can extend a grant 7 months past the date of the contract and it's a different vendor. Is that? And then we only have another 2 months left in the contract. Is that doesn't sound right.
This project or this item, I would say, is the absolute perfect storm. The VOCA grant, as I said, expired on September 30th of 2020, but most of the time you're not going to get your award or be able to determine whether or not you're going to have enough funding to cover it till after that that contract or that grant term has expired. So that was kind of our first setback. And then when we realized that we were not going to have enough VOCA funding, we had to kind of scramble around a little bit and find additional reclaim funds that we could utilize for the project. So by the time we had gotten the award from VOCA that we didn't have enough, and we reevaluated our reclaim plan, we then had to submit that for approval and request additional appropriation and activities to get this kind of going in the system. It was then, December of 2020, and we still needed to get this moving. So there was just a very perfect storm of everything that happened. And then once we were able to convert the item over at the tail end of last year, we kind of ran into a lot of those system issues and staff learning curves and waiting for approvals and things like that. So our hope going forward is that this would be incorporated in our reclaim grant going forward. But right now we're still waiting on our reclaim plan to be developed and approved. So we don't have 100% guarantee that we can incorporate this into next year's plan. Our goal is to do so, but once we get that confirmation from the state, then our plan is to amend this to accommodate the next state fiscal year.
Okay, so we may see you back then with a new contract using the reclaim grant funds. Is that
correct? Yes.
And that will be what, for 2 years or?
We typically do all of our reclaim contracts on an annual basis since it's the state fiscal year, and we can never be 100% guaranteed of what our funding will be the following year, whether or not we get any variable funding or if we're just getting our static reclaim allocation. So we typically do our reclaim contracts on an annual basis.
Okay, even though this contract was for 2 years, with the reclaim grant, you think it'll only be for 1 year?
At this point in time, I think that's our plan, yes.
Okay. All right, thank you. Good clarification, I appreciate it.
Any additional questions from the board? Hearing none, then I will make a motion to approve. Do I have a second?
Second, Miller.
Seconded by Councilman Miller. All those in favor say aye.
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 Opposed? Item approved. Next item.
Next item, BC 2021-208, Medical Examiner's Office, submitting an RFP exemption on requisition 6199, which will result in a payment to Thermo Electron North America in the amount not to exceed $4,484 for specialized cleaning services of TSQ Altus Quantus Mass Spectrometer, and recommending the award in connection with said RFP exemption.
Hugh Shannon, Medical Examiner's Office. This was an emergency repair back at the end of January. The TSQ is kind of the more advanced model that we've started transferring a lot of the work of the toxicology lab over to. So the reason that this is being done in this fashion is as I said, the repair was done at the end of January. We had a transition in our procurement staff in February. So the new team was kind of on board at the end of February and picked this up in March. And because it had been so far past the actual date of service, they did it as an exemption instead of time-sensitive mission critical.
Okay, Hugh, thank you very much. Are there any questions from the board on this item?
I may just, again, for clarification. So Hugh, you're saying that in a stable office environment where you didn't have the turnover, this would have been given to us as a mission critical in January?
Correct.
Okay. Thank you.
Any final questions on this item? Okay, hearing none, I will make a motion to approve. Do I have a second?
Second, Miller.
Seconded by Councilman Miller. All those in favor, please say aye.
Aye.
Opposed? Item approved. Moving on
Thank you.
to today's consent agenda.
Yes, moving on to consent agenda items number BC 2021-209 through 212.
Board members, please take a look. Feel free to speak at any time. Any questions? Give you a moment or two. Does anybody have any questions on today's consent agenda items?
Nan Baker, if I may.
Please.
On the 212, we asked if we know how many inmates have needed emergency medical services. There wasn't a response to that. Do we have one now, or is that still unknown?
This is Laura Sims from the Sheriff's Office. I have an answer for you. It's an estimate, and what we've got is about 850. And that's an approximation, because it's, I'd have to, in order to get like the number, I think we may need to start working with the Metro to kind of help track some of that, because the problem is what we get are the invoices when they come in after the fact, after they've already been sent, for service. And so, for example, what we may get is several invoices for one inmate. So they may go to the hospital, but then, there's a bill for the EMS service to send them there. And then we have a bill, a separate bill for the outside medical for the hospital. And then maybe later they have to get, dialysis or something, so then that's a separate bill. So we have a variety of bills that go with the different inmates, and then it can happen more than once. So like one inmate might go once, 1 week, and then another week they have to go back again. So even though I can tell you, but then that's going to be one inmate, but they've had a whole variety of services. Do you know what I'm saying? Mm-hmm. So it's kind of difficult to for us to pull from the invoices specifically how many, but the best estimate that I can give you for 2020 is 850 inmates were sent out for service.
And if I may, so of that 850, do we have a percentage of how many went to Metro and how many went elsewhere?
Well, about 825 went to Metro, and the rest of the other 25 outside of 4. And now that is only for hospital services. Like there's other services then that would be different for dialysis and prosthetics, ambulance, renal care, that kind of that stuff as well.
Okay, so of the 825, 25% of those were outside of Metro. And the list that you're giving us of 404, 042, 043, 044, and 045, that makes up the 25%?
The 4 that are on there? No, that's not correct. No, because the 4 that are on the thing right now, those are only specifically for St. Vincent's University dialysis and prosthetics. We also have, the Metro Health contract, but then the ones that we were talking about, the 825 that went to Metro, we also get outside medical billing that gets paid for, that's in addition to the contract fees that we pay.
And Councilwoman Baker, this is Donna. I'm going to jump in here just to give you an idea. Like Laura was saying, one inmate can have several cases, but in terms of caseload, last year for 2020 so far, we have paid $1,051,214. That's for 3,139 cases. Again, that's probably not the number of inmates, that's cases, as one inmate can have several cases. These last 13 cases are what's on the agenda today, which is totaling $37,322. That again is for 13 more cases. I don't know how many inmates that's affecting, but this is the case numbers, and that's the case load. Does that make sense?
Yes, that's really helpful. Thank you.
Okay.
I see also noted that it's Metro that makes the decision. Am I reading that correction? Metro decides who does and who does not go outside the jail for care. So they're
Absolutely.
determining whether or not it will go to Metro or whether they can't provide the service.
This is correct. Yes. Now, one of the things I just want to point out to you, what we were talking about here, the 4 that are on the agenda today, this is for 2020 billing services that happened during 2020.
This is all 2020 to clean up 2020.
Correct. So we may have additional coming for 2021. Because we tried to originally put it all together on one PO and include 2020 with the 2021, so we only had to bring it all together at one time. However, because of the way the alternate procurement reads that was approved for these prior to it being on here, we end up having to split it out so that we do it per calendar year when we make our purchase order requests.
Okay. Well, it's good to know that you've already noted that it's Metro, given we have the contract with Metro, they're present, that they are the ones making the decisions of where these inmates go. So,
Absolutely, 100%. They make the decision whether an inmate gets treated in-house or whether it goes out. And once they decide it goes out, they decide where it goes. Sometimes, and I don't really know their reasoning. And my understanding is some hospitals might specialize in something that another one doesn't, or Metro itself may be too crowded at the time. But that's some of the things I've been told that kind of dictates some of their decisions where they're sending them.
And on an average, it's usually a 75-25. 75 stays in Metro, 25 is out.
Absolutely, but the bulk of them go to Metro Health, yes.
Correct.
Okay, thank you. I appreciate that. It's good to know.
Are there any follow-up questions on this item? Or any of the item on the consent? Okay, hearing none, then I'm going to approve today's consent agenda items as listed. Do I have a second, please?
I'll second, Man Baker.
Seconded by Councilwoman Baker. All those in favor say aye.
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 Opposed? Today's consent agenda is approved. Moving on to other business.
Yes, we have one time sensitive mission critical item, BC 2021-213, Medical Examiner's Office, recommending an award on a purchase order to Fisher Scientific Company LLC in the amount not to exceed $7,059.79 for glass top vials, inserts, and caps, and acetonitrile for toxicology lab.
Hugh Shannon, Medical Examiner's Office. This was a procurement item that was filed at the end of 2020. We do quarterly ordering, but again, due to the transition in the procurement, this particular order was never fulfilled on our end by our previous procurement officer. And again, when the new team came in at the end of February, they were getting, all of the orders ready for the coming, the next quarter, and toxicology continued to ask about this particular order. Their supply was running dangerously low, so they requested that it be done in a time-sensitive manner. Basically, these items are necessary for us to process all of our toxicology in the lab, and simply it will shut the entire lab down without them.
Thank you, Hugh. Are there any questions from the board on this item?
Just one question. Hugh, do you feel that your team now has everything in place and that you shouldn't need any more mission criticals?
They're up to speed. They're working very well. They've been meeting with all of the laboratories and all the different units and sections. Everybody's very happy with the new team, so I don't anticipate that there would be many problems going forward.
Okay, good. Thank you.
Thank you.
Any final questions on this item?
Mr. Chair,
Hearing none?
I
Please.
just have a administrative question on how does this item get listed as time sensitive / mission critical versus just being on the regular printed agenda? How do we separate the two?
I'll defer to my team on that one.
Lenora Lockett, Office of Procurement and Diversity. Department enters the on-base transaction. And this one is a time sensitive mission critical. It still goes through the infor system. And then once they get the review approval by the buyer at the end, they get the notice that it's ready to be entered into on-base, for the agenda, and the department user creates the on-base transaction.
Okay, I'm still not really.
So
clear
is it, Trevor, Lenore Lockett again. So is it regarding the timing or the difference between the last item or the previous item by the medical examiner?
Well, I mean, on the agenda, we have, contracts and items that are months, months delayed. And I mean, I don't see how this one, and Lenore, we could talk. I'm just curious of what makes this one time sensitive, right? It's urgent, obviously, but they still got it in the system. I just don't know why it wouldn't be listed under the normal items versus separating this out under time sensitive mission critical.
Okay. Without all going into all the nuances, Lenore Lockett, Office of Procurement and Diversity again. So time sensitive mission criticals, they do a procurement process and then they enter the item in the system. And in this case, they should have posted it for 8 hours and they could do an informal, the 3 quotes and get it submitted. And they basically authorize the vendor before it gets on the Board of Control agenda. So that's what makes it a time sensitive mission critical. If they do a regular informal and it's over 5,000, then it has to come to the board for approval of that procurement process, which is and before they authorize it with the vendor. Then if you see a DO or an item listed on the DO list that's under 5,000, now again, over 1,000, but under 5,000, that item doesn't require Board of Control approval, except if it was not processed and approved by the OPD buyer prior to the item being authorized by the department. So in that case, that might be an item that they did not do a time sensitive mission critical. And it was determined that they authorized it prior to it completing the infor approval in the workflow in the infor system. That would not require Board of Control, except that by the time it was reached the board OPD buyer queue, it was already determined that it had already been authorized. And in that case, it'll appear on that second chart of the agenda as prior invoice, or let me see, what's the title? Services received and invoiced but not paid. So some of those are exemptions, and they usually have the asterisk that lets you know what exemption, what alternate procurement was already approved for those items. Because either we already knew that the timing would not allow them to get prior approval, and if they do not have an asterisk, that means that by the time it got to the OPD buyer queue and it was under 5,000, it was already authorized. Then if it's time sensitive mission critical, is separated because the Board of Control still has to confirm that they agree with the department that time sensitive mission critical was there. We agree with their sentiment that it was a time sensitive mission critical item that they had to approve before it even went through the process.
Okay.
Does that help, Trevor? Yep. Okay.
Helps enough.
We can still talk, but it's
sounds good, Lenore. All right. Okay. Thank you.
Okay. At this time, then I'm going to make a motion to approve this item. Do I have a second?
Second.
Seconded by Councilman Miller. All those in favor say aye.
Aye.
Opposed? Item approved.
Thank you.
Moving on to public comment. If anyone from the public wishes to speak, you may do so now. Okay, we have no public comment. At this time, I'm going to make a motion to adjourn. Do I have a second?
Second.
Tucker, seconded by Ms. Tucker. All those in favor say aye.
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 Opposed? We are adjourned. Once again, thank you all for your time.